Dr. Patino here at the Cosmetic Surgical Center for Surgery. We're gonna do a male high definition liposculpture. So I'm gonna make it look like he has muscles. And so this is micro-reparo assisted. So it's like a toothbrush, it's electric toothbrush. I go, the tip vibrates. I don't have to be jamming the instrument back and forth, right? I just go in, and now we're gonna do this line over here. That's the semilunar line. That's the line that marks the border of the rectus abdominal wall muscle, right? Incredible. So look at the fat that's coming out. What color is that?
Yellow fat.
Absolutely yellow, beautiful fat. Do you see any bleeding? Any speck of blood? Not even a speck of blood. It's just. Are you surprised?
Not at all.
No, why is that?
Because of the technique that you use, doctor.
Yeah, we do it all the time, right?
All the time.
Beautiful. It almost looks like neon fat, man.
Right, golden.
Like gold, pure gold. And this is incredible. And we're not even doing a fat transfer or anything. This is just a pure liposuction, but even then, we would like to limit the amount of bleeding. So we want to basically decrease the risk of anemia, blood transfusion, return to the operating room for bleeding, which is something we never done. And so this is great, but it's definitely a different technique. The patient has to be instructed not to take any aspirin-like medications, no ibuprofen, no herbs, no vitamins for 2 weeks before and 2 weeks after the procedure. Look how slow my strokes are. My strokes are extremely slow.
Very gentle.
Yeah, very gentle on the tissue. So also the risk of perforating an organ, intra-abdominal organ or intrathoracic organ, is much less. Why? Because you go slow. And we never had that problem, thanks to God. We never had anybody. This has never happened to me, but I believe in what evidence has shown is that it usually happens to a tired surgeon, maybe on a Friday afternoon after doing many cases. We only limit 1 or 2 cases per day, that's it. And so, I'm very fresh, I'm not tired. So it's similar to driving a car, right? If you are, driving at full speed, maybe. Yeah, it's much like driving a car. I go slow, we still have the same risk, but by going slow, it's like going in a car slow, right? You go slow, much less risk of an accident, right? And if you get in an accident, it's probably not going to be that bad. But if you're at full speed and maybe at night and tired, much more risk of a rollover because you fell asleep or going into an unintended area, right? You lose control of the vehicle, and it's no different here. And so it's something that has never happened to me, and it protects my patients. I believe also being ambidextrous is important to have the surgeon use both hands. It protects the patient because even if you're not ambidextrous, you're probably going to go slow with your non-dominant hand. And going slow is the key. Thank you. So being ambidextrous is also good for not only the patient because there's much less risk of, I would say, internal organ injury, something that has never happened to us. Also, you can probably get, this nice aspirate, right? It's almost like beige fat, bloodless. But also, because I use like 50% my right hand, 50% my left hand, it's also good for the surgeon because it decreases the risk of occupational injuries in the form of tendinitis to the wrist, the elbow, or the shoulder. Thank you. All right, so notice, this is my non-dominant hand, right? So I'm going with my left hand. So we do 50% with the left hand, but look at the output. Look how it's like neon-like output. And so it limits the risk on the patient, right? Because, you tend to go slower, right? And I go slow, but